السلام عليكم ورحمة الله وبركاته. Our lecture today about policies and practice of public health under supervision, Professor Amel El-said, prepared by Abir Ahmed Negi. Objective. General objective. After completing this module, you will be able to effectively identify policies and practice of public health. Specific objective. Define of policies and practice. Identify important national health policies, strategies, and plans. Principles of ethical practice of public health. Factors of public health care process, planning and implementation. Core function of public health. Policy development. Implementation of health policy. Introduction. Public health includes policy, practice, and research. Health policy refers to decisions, plans, and actions that are undertaken to achieve specific health care goals within a society. Health policy can achieve several things. It defines a vision for the future, which in turn help to establish targets and points of reference for the short and medium term. It outlines priorities and the expected roles of different groups, and it builds consensus and informs people. Public health practice involves direct performance or oversight by a governmental public health authority and has public accountability, where the benefits and risks are primarily designed to accrue the participating community. Public health practice is dominated by the use of standard, accepted, and proven intervention to address known or suspected public health problems. Health policy is legislation or other government action that deal with the influences that help or interfere with reaching health goals on public level. Public health practices are collection and analysis of identifiable health data by public health authority for the purpose of protecting the health of particular community. Importance. National health policies, strategies, plans play an essential role in defining country's vision, policy direction, and strategies for ensuring the health of its population. Develop robust response to the growing calls for strengthening of health systems and the renewal of primary health care. Serve to guide and steer the entire pluralist health sector rather than being command and control plan for public sector. Addressing the social determinants of health and interaction between the health sector and other sectors in society. Principles of ethical practice of public health. Public health should address causes of disease and requirement for health, aiming to prevent adverse health. Respect the right of individuals in the community. Empowerment of community members ensures that the basic resources and conditions necessary for health are accessible to all. Seek to the information needed to implement effective policies and programs that protect and promote health. Public health policies programs should developed and evaluated through processes that ensure an opportunity for input from community members. Incorporate a variety of approaches that anticipate and respect diverse values, beliefs, and cultures in the community. Implemented in the manner that most enhances the physical and social environment. Public health institutions should provide communities with the information they have that is needed for decision on policies or programs, and should obtain the community's consent for their implementation. Act in timely manner on the information they have within the resources and the mandate given to them by the public. Public health institutions should protect the confidentiality of information that can bring harm to an individual or community if made public. Ensure the professional competence of their employees. engage in collaboration and affiliation in the ways that build public trust and institution effectiveness. Factors of public healthcare policies planning and implementation. Emerging infectious disease, economic factor, financial factor, healthcare infrastructure, preventive measures, preparedness, environmental condition, education and awareness, technology, epidemiology of disease. Core function of public health. 1. Policy development. The three essential surfaces of policy development include the following: inform, educate, and empower people about health issues. Mobilize community partnerships to identify and solve health problems. Develop policies and plans that support individual and community health efforts. As following: assessment, policy development, assurance. Types of health policy. Regulatory. Health policy helps the government to standardize specific groups and their behaviors, such as banning smoking in public areas to improve health. Allocative. Health policy is driven by income, services, or goods that benefit one group or organization over another. This includes funding for research and supporting Medicare. Health-related policies. It's important for the overall workplace health program to contain a combination of individual and organizational level strategies and intervention to influence health, including health-related policies are formal or informal written statements that are designed to protect or promote employee health. Supportive workplace health policies affect large groups of workers simultaneously and make adopting health behavior much easier. They can also create and foster company culture of health. Examples of health policies. Policies prohibiting tobacco and alcohol use at workplace. Policies requiring health food to be served at company, meeting and events. Policies allowing for flex time to exercise or attend health programs. Health policies affect organizations and individuals. Organizations include medical schools, health management organizations, medical technology companies, employees, and nursing home individuals. Include medical doctors as well as classes or groups of people like elderly, the poor, and children. Policies that are not specifically health related. Policies have health impact on employees. Human resources policies, such as those related to work hours, flexible scheduling, work organization, and supervisory style, should be developed with desired health goals in the mind. Workplace health programs are not added on benefit but similar to training, monitoring, and other employee development programs. Regardless of which intervention are selected, the program should serve to use multiple interventions such as combining a policy and health benefit intervention for a single health issue. Combinations are more effective than any one intervention alone. Use interventions that address multiple health issues at the same time, which is more effective than addressing each single health issue separately. Core function number 2. Implementation of health policy. Components of implementing health policy. In innovation, a technical package, communication, partnership, management, and political commitment. Health policies can be implemented at all levels of government system. Small-scale health policies affect clinics, providers, and individual hospitals. Larger scale health policies affect organizations at the city, state, national, and international level. Implementation is important to public health in order to improve the health quality and the health services to improve the overall quality of life each member of society. The involvement of government can bring to the light the health issues affecting the world and then work towards a common goal. Organization address 6 case areas. In innovation, to develop the evidence base for action. A technical package of limited number high priority evidence-based interventions that together will have a major impact. Effective performance management, especially through rigorous real-time monitoring, evaluation, and program improvement. Parentership and coalition with public and private sector organizations. Communication of accurate and timely information to the healthcare community, decision makers, and public to the effect behavior change, and engage civil society. Political commitment to obtain resources and support for effective action. Provide government with a strong foundation for action. Effectively engaged political commitment leads to the resources and support needed to coordinate, implement, and sustain public health interventions, including policy change where needed. A change is often controversial, and the entities that implement public health programs, usually led by public health departments or other government agencies, may have less ability to influence budget and policy decisions than other groups within government and civil society. Health in all policies approach is one way to routinely consider the health impact of the all public policies developed by the public health community. The approach recognizes that all stakeholders have something to gain from changing how public agencies work together and how public policy decisions are made. Integrated services is the integrated services approach which focuses on public programs that integrate and connect clinical care with other services that impact health. Home visits, clinically driven programs, parting words. Home visits. Home visiting programs are a good example of an integrated service that has proven successful at addressing multiple drivers of health through a single point of entry. The programs pay for trained professionals in health, social work, and/or education to visit the homes of low-income pregnant women, infants, and young children to provide guidance and assistance. Such programs have shown positive results for a number of social and economic factors that can influence a child's health, development, school readiness, and long-term outcomes. For example, home visiting programs may help mothers with education and employment goals, connect families to the other community resources, and reduce exposure to crime by addressing domestic violence. Similar programs focused on ensuring the safety of Medicare patients' homes and helping elderly patients take better care of themselves have shown promise in maximizing effectiveness of clinical care. Clinically driven programs. Another example of integrated services are clinical approaches that directly address the drivers of health. Some hospital systems, for example, are working to connect high-cost patients with non-clinical needs like food and housing. Parting words. All policy decisions have trade-offs as our states policymakers weigh these trade-offs, they should also consider how policies will affect health and well-being of in turn how health and well-being of will affect a broad range of policy objectives. Thank you.